Okay, I'll just wait a couple minutes here, guys. There's some more people to show up. All right, we'll just wait one more minute and then we'll see who we've got and then we'll get started here. So today is all about joints. All right. Okay. Just quickly adding one more thing to my notes, and it's just need to make it there. The list. That's what I'm looking for. Okay. We are talking about joints today. Just fix my animation here, and then we are good to go. And there we are. And there we are. Okay. So I hope everyone's doing good. It looks like the sun's shining. I think it's supposed to be a high of 16 or 17 today. So make sure you get some time outside to enjoy that. We are today talking about joints. So don't forget, you do have a quiz that is posted on Moodle, and that's for the skeletal system. So I extended it to go until midnight tonight. So make sure that that is done. It opened on Monday. I also shared with you a muscular system worksheet. So that is due tomorrow at noon. So make sure that gets done. And yeah, so we are moving on to joints. We're not going to finish the PowerPoint on joints today. And just to remind you of some of the deadline or dates that are coming up. Friday, we don't have class because it's a PD day. And Monday, we don't have class because it's Victoria Day. So this is our last class before next Wednesday, okay? So we're gonna finish, we're gonna start joints today. We're gonna finish it next Wednesday, and then have a quiz on joints and muscles. So that won't be until after next Wednesday, okay? So just so you're aware of that. Also, I haven't had an opportunity to post my notes for joints yet, but they'll be posted before the end of today, okay? So I'm not going to give you a worksheet on it because we're not going to finish the booklet. So the 4 days, over these next 4 days that you have off of school, just make sure that you finish the muscular worksheet, which should be done by tomorrow anyway, and it's not very long. Okay, so let's start talking about joints. There we are. And just going to, why did that happen? There we go. Okay, so just want to go to the beginning. And there we are. Joints. Okay, so what is a joint? A joint is a connection between a couple of bones or more bones. So 2 bones or more than 2 bones, okay? And we're going to talk about different types of joints, so 3 different categories of joints. And then we're going to look more closely at one of those categories, the one we most closely relate to what a joint is, okay? All right, so first our 3 categories we're going to look at for joints. The first one here we talk about is called a fibrous joint, okay? So a fibrous joint, so it's a connection between bones, but it's an immovable connection. Okay, so the example of that we see here is with a skull. So we see all these fissures between the bones, right? So we learned about the frontal bone and parietal bones and occipital bone and temporal bones. Well, between those bones, right, all these these are called joints. But there's a special kind of joint called a fibrous joint. So they're not meant for moving, and they're filled with fibrous material. So this particular, the way that we're categorizing the bones is about the type of material that's between the bones, and then that leads to the type of movement of the joint. Okay, so this is an immovable joint, and it's called a fibrous joint because it has fiber between the bones. Okay, the next kind is called a cartilaginous joint. So cartilaginous joints have cartilage between them, hence the name. So we can see different examples. So cartilaginous joints are partially movable. So they have some flexibility. So if we think about our cartilage here, right? So the cartilage here is what's connecting our ribs to our sternum. Okay, so we see all of this cartilage connecting our ribs to our sternum. They're not immovable, right? You can just push on your ribs and you can feel your ribs going in and out. It's not this solid surface that you feel when you feel your skull, right? So it allows a little bit more shock absorbing. And then if we look over here, we see the intervertebral discs. So those are the discs between all of the separate vertebrae, and they also allow us to have some flexibility, right? Because if this was all one solid bone, like I said before, we wouldn't be able to bend our back forward or backward or extend it or do all those movements we do with our back. Okay, so those are an example of a cartilaginous joint. Okay, so cartilage is between the bones. Now, the one that we're the most, we think about the most when we talk about joints are the next group, and these are called the synovial joints. Okay, so that might not be a name that's familiar to you, but we understand these joints. So these are the joints that have a lot of movement, right? So when we're looking to move our body, whether it's to raise our hands in class, right? Whether it's to wiggle our fingers, when we're moving those joints, it's allowing our bones to move that are on either side of the joint. So these are movable joints. And between the bones, it's not fibrous material, right? So it's not fiber like the fibrous joint. It's not cartilage like the cartilaginous joint. It's called a joint cavity, okay? And we're going to learn more about that structure in a second here. And it's filled with a fluid that's described as being like a thick egg white. And that's what's in the joint cavity. So that's separating our bones is this fluid called synovial fluid, okay? All right, so let's take a look up here. So this is a knee joint. And if we take a look at the knee joint here, what we see is we've got ligaments. We're going to talk about those in a minute, but ligaments are what hold the two bones together, okay? This is our joint cavity right here. And we see the different parts of our joint cavity, but within that, we have a synovial membrane, and then within that, we have this liquid, the synovial fluid, okay? If we go down here, and in this one, we're looking at an elbow, right? We have the joint cavity. So there's this joint capsule that's going over. And that joint capsule is going over here on this bone. And what it does is it actually fits over the two bones that are connected by the joint like a little sleeve. Okay, so it kind of keeps them, they can still move, but it kind of holds those two bones together. So here's the joint capsule. So there's ligaments there. There's articular cartilage, which is attached to the ends of our long bones. And then in the middle there is the synovial fluid. And the synovial fluid is going to keep those bones from rubbing against one another, okay? Which would be very painful. All right, so let's look at the different parts that make up this synovial joint, okay? So that's our next thing to talk about is the parts of the synovial joint. So we're going to start here with the ligament. So ligament is a fibrous material or connective tissue that joins the bones together. Okay, so it attaches the bones together. So if we hyperextend something, we might tear a ligament. The joint capsule, so we see the joint capsule sort of fits over these two end bits of the bone that's held together with the joint, okay, like a sleeve. The synovial membrane, that's the membrane here that has the synovial fluid on the inside, okay. Then we take a look at our long bones, and our long bones are both covered with what's called articular cartilage. And this articular cartilage is this smooth, sort of rubbery material that if those bones, because they're separated by the synovial fluid, but if they come into contact, they slide nicely along one another. If we lose that cartilage and they bang against each other, that causes a lot of pain. And then we have the joint cavity. And within the joint cavity is the synovial fluid, okay? All right, so we're gonna start with looking at ligaments. So ligaments, connective tissue, so they hold the bones together at the synovial joint, and they help to stabilize the joint, okay? So let's look at this image to the right. We see some different ligaments here. So there's 4 different ligaments that are associated with our knee. So if I take a look at this ligament here, so we have the LCL, the PCL, the ACL, and the MCL. And these, so you might have heard of people, ACL is a pretty common one to cause damage to. So that's where it is right here, okay? Sometimes the PCL, sometimes, so they all can be damaged. So if I look at this one's connecting the femur with the fibula at this joint. So remember, fibula is the smaller bone of the 2 lower leg bones. Okay, here on this side we have the femur connected to the tibia. All right, over here we're looking at some connections between the tibia and the patella. Okay, so what we're looking at here is we have these ligaments, and if we do damage to our knee, we could tear or like have a little tear or completely sever one of these ligaments. And a friend of mine, her daughter went skiing about 1.5 years ago and damaged all 4 of these ligaments. So she was in crutches and unable to walk and had to go for surgery. It was a big thing for her. Okay, let's look at this picture here on the left. So if we take a look at these ligaments, so these are the ones in our ankle, and again, they're stabilizing that joint and they're holding the bones together, right? So if we look at this ligament, okay, so we have the posterior inferior tibiofibular ligament. Okay, so we see from the name it's attaching the tibia and the fibula. The talofibular, okay, so that's attaching the fibula with the talus, okay, or one of the tarsals. Inferior tibulofibular, sorry, and then the talofibular. So that's the talus with the fibula. So it's connecting those bones together in our foot. Okay, so we're just going to watch a little video here on ligaments. It's like a minute. Okay, and we'll share that with you. Open menu here. Open. There we go.
What are ligaments? Ligaments are connective tissue that connect bones to other bones. They're made up of collagen fibers, which are packed close together. Collagen is a structural protein that is found in connective tissues, bones, skin, and blood vessels. Ligaments limit how much a joint can move in a given direction, so they stabilize the joint. Ligaments also protect joints and bones as they can absorb some shock as the body moves. Ligaments can stretch a little bit, however, if they're lengthened too much, the joint can be weakened, creating future issues. Several things can affect ligaments, which in turn can affect the joint's range of motion or restrict flexibility. Inactivity and overdeveloped muscles can have negative effects on joints and range of motion. Overstretching can damage ligaments and decrease joint stabilization. And aging can negatively affect ligaments and joints, but regular exercise can delay this process. If we take a look at a knee joint, we can see 4 different ligaments: the ACL, PCL, MCL, and LCL. Ligaments can suffer partial or complete tears as you see in this illustration. Most common ligament damage occurs in athletes, for instance in the ACL. If it's a partial tear, a surgeon will typically attempt to stitch it. If it's a full tear, it's much more complicated, and usually a surgeon will replace the ligament with a piece of healthy tendon. And that be the basics on ligaments. What?
There we go. Okay, let's go back to the PowerPoint. Okay, so that's the ligament part of a synovial joint. So let's keep going here. Articular cartilage. Okay, so articular cartilage. So that's the cartilage that's going at the ends of the long bones. Remember, we looked at images of the epiphysis. Right on the ends of the epiphysis, we have this articular cartilage. So we have this nice little layer. And again, that keeps the bones from rubbing just bone against bone. Okay, so it's a white rubbery substance. Covers the ends of bones at joints where the two bony surfaces move against each other. Okay. Resists wear by minimizing friction. Now there's one of the more common diseases. So if you actually, first of all, you could injure your articular cartilage. So if you land smack on your knee really hard, that can cause damage. And those cells that produce cartilage don't do it on a very quick basis. So these take time to heal. If you suffer from osteoarthritis, what that means is your cartilage is actually starting to break down. So your cartilage is breaking down, which means your bones will start to rub against each other. So even though there's this nice synovial fluid between them, they can still rub against each other and cause pain. Okay. All right, the next thing we have here is the meniscus. So the meniscus is a little pad of cartilage that lies between bones in a synovial joint. And basically what its job is to allow those bones to kind of fit together a little more snugly. So we have them in our knees and our wrists. Most commonly we hear about people causing damage to the meniscus in their knees. Okay, so this is an extra piece of cartilage in the knee that helps that the knee to come together. So the tibia and the femur actually to fit together a little nicer. Okay, so that's the meniscus. The bursae. So the bursae are little sacs, and they're little sacs of synovial fluid, and how they're described is like little teeny tiny flat water balloons that have just a little bit of fluid on the inside of them. Now what these guys do is they reduce friction between the bone and other tissue. So it could be between the bone and the tendon, could be between the bone and muscles, bone and ligaments, or the bone and even skin. Okay, so they reduce the friction when those two are coming close together. It kind of fits in between there to prevent the friction from happening. And some are shock absorbers. So if we look here, we're looking at the patella of a knee, right? So when we land on our knee, that actually helps to absorb a bit of that hit of hitting our knee to prevent the damage to our patella and other parts of that joint. Okay, so we see these bursae at our elbows, knees, shoulders, and hips. So that's the more common locations of them. Here's a couple other examples. So if I look here, here's a bursae in your shoulder, right? Now we can have an infection or an inflammation rather of our bursae, that's called bursitis, and that can actually cause it so the movement of that joint becomes extremely painful. So if we have bursitis here in our shoulder, any movement of the shoulder could be really painful. Bursitis here in our elbow. So if we have bursitis here, that's often called tennis elbow, and it really starts to hurt, right? And often we can get that from overuse injuries. So like a tennis player is always going to be bending their elbow. That's primarily how you play tennis. And then we have bursae here in the hip joint as well. Okay, so we're going to watch just a short little video, and this one is a summary of the 3 different categories of joints, and then looking at some of the parts of the synovial joint.
What are joints? In the body, a joint is a place where two or more bones are joined by soft tissue. If two bones meet, it's a simple joint, and if three or more bones meet, it's a compound joint. Joints have three main functions: to join bones together, to bear weight, and to allow the body to move. There are many different ways to classify joints, and in this video, we're going to divide them into three groups: fibrous, cartilaginous, and synovial. Fibrous joints allow very little movement and are attached by dense fibrous connective tissue. The connection between the radius and the ulna bones in the forearm is an example of a fibrous joint. Cartilaginous joints are joints where bones are connected by cartilaginous tissue, which allows for a limited amount of movement. The discs located in the spine are an example of cartilaginous joints. Synovial joints are the most complicated joints in the body, and they're the types of joints that most people think of when they think about joints. Synovial joints allow for a great deal of movement, and the bones of a synovial joint are connected by a joint capsule, such as the shoulder, knee, and elbow joints. The joint capsule has an outer fibrous layer and an inner synovial membrane layer. The synovial membrane layer secretes synovial fluid, which reduces friction between the articular cartilage of bones during physical movement, aids in shock absorption, and aids in nutrient and waste transportation. Ligaments and tendons surround many joints, and they help protect joints and bones by absorbing some of the shock as the body moves. Some common joint injuries include ligament or tendon tears, which limits the range of motion of the joint. This is in many times caused by overuse or overextension of the joint. Meniscal tears in the knee joint, usually caused by wear and tear over time, and damage to articular cartilage that covers ends of bones, usually caused by falling directly onto the joint. Joint dislocation can also happen, and that's when a bone slips out of a joint, which is also usually caused by a fall. Arthritis is the most common joint disease, and there are over 100 different forms of arthritis, with osteoarthritis and rheumatoid arthritis being the most common. Osteoarthritis is when there is a reduction in the amount of cartilage tissue of the joint, usually resulting in bones rubbing on bones, and can be brought on by regular wear and tear or injury to the joint. Rheumatoid arthritis is a disorder where the immune system attacks body tissues. Things you can do to maintain and improve joint health include maintaining a healthy weight, which will put less stress on joints, eat plenty of nutrient-dense foods like fruits, veggies, whole grains, and healthy fats, drink plenty of water, which can help joints stay lubricated, stay active, stretch regularly, putting joints through their normal range of motion, and avoid the same repetitive movements. And that be the basics on joints.
So avoiding repetitive movements is something that's important. Although if you play a single sport, if you're sort of a single sport person, you tend to have overuse injuries from those sports because you're overusing that joint. You're using it a lot, like I talked about with tennis, right? So there's some sports where there's more injury, different types of injuries that are more common, depending on what joint you tend to move the most. Okay, so back to the PowerPoint here. All right. Oh, that's what I wanted. Try that again. And there. One more time. Okay. Let's just maybe close that. That's weird. Okay, we'll try this one. Okay. Sure, I didn't want to go back to the one we did before, but that's okay. Just go back to this. And here's what we're doing. Okay. So next we're going to talk about types of synovial joints. So there's 6 main types of synovial joints. Okay. So we'll go through all 6 of these types in some detail here. So let's start with a pivot joint. Okay, so a pivot joint is a joint that kind of moves along an axis. So just like a tire moves along an axis, right? So the tire is kind of moving along the axis. That's how these types of joints move, is they move along an axis. So if we talk about in our neck, okay, the 2 top bones of our cervical vertebrae one of them's kind of the stabilizer and the other one moves around it. And by moving it around it, we can look left and right. We can pivot our head, okay? A hinge joint, well, you guys all see hinges in your doors, right? Hinges go like this. Well, that's essentially what a hinge joint does, okay? So the hinge joint that we have, right? Our knee is a hinge joint, right? We can move up and back with our knee. We have a hinge joint here with our elbow, okay? And our little bones have to fit together in order to allow these types of movements to occur. A saddle joint. So the saddle joint here is right here in the base of my thumb, okay? So other primates have 5 fingers like we do, but they don't have the opposable thumb like we do, which gives us a lot more flexibility. So this particular saddle joint is right here between my wrist bones, my carpals, and my metacarpal, which is right here in my palm, and that's where that is, okay? And that allows my thumb to move in all of these cool directions, okay? The ball and socket joint, so that's the one we see up here. The ball and socket joint is the one that gives us the most or the largest range of motion. And basically the one end of the bone is like a ball, and the other end from the other side is like a socket that it fits into like this. So it allows this range. So our hip joint works that way, as does our shoulder joint. So we have this huge flexibility here with your shoulder. The condyloid joint is the joint that makes our knuckles, okay? So we have our metacarpals, which are the bones here in the palm. I can also think of them as the bones here in the back of my hand, right? The same bones. And they're joining, it says in the image, phalanx, my phalanges, okay? And they're fitting together. So those bones are coming together right here, and those are my knuckles, okay? And then lastly, this is the joint with the least movement, and these are our plane joints or gliding joints. And these are our little bones that are moving side by side. So that allows me to move my wrist, okay? So I have this movement in my wrist, okay? That's these little bones here that are moving, and they're moving side by side, and I can do that with my tarsals as well in my foot, okay? All right, so we're gonna talk again about these. So first, the ball and socket joint. So this is the joint that gives us the most mobility. So it allows us to move in a lot of different directions along this central point, right? So we have the ball fitting into the socket. So this image here is showing us the hip. So we have the end point bone of the femur fitting into the socket, which would be my hip bone, okay? Greatest movement, and we find these in our shoulders and our hip joints, okay? Next, we have the hinge joint that I just talked about. So the hinge joint is what changes as a change in the angle, okay? So we're changing the angle of the bone. So here I'm changing the angle to make it come smaller and to make it get bigger. So I see these, this is the example of the elbow, right? But I see these in my elbow, I see these in my phalanges. So remember, my phalanges are just my fingers. So me bending my finger bones, okay? Those are hinge joints. Pivot joints, so again, we're turning along an axis. So that's my head, right? So I have to have one bone that kind of stabilizes and the other one can move around that. Also, the proximal, the end that's closest to my torso of my radius and ulna. So remember, that's the bones of my forearm. They also move along a pivot, and that's what allows me to have the pronation and supination. Because when I have pronation, they cross, and then supination, they run parallel to one another, okay? So the two upper bones of my neck, which is my cervical vertebrae, the two top bones of that, and then the proximal ends of my radius and ulna. Next, the gliding joints or plane joints. Either name is fine, and they move past one another. So these are the bones here, this example, in my carpals, which is my wrist, right here, okay? They can move past one another. So wrists and ankles, so my carpals and tarsals. The condyloid joint, Okay, allows movement in 2 directions. So rounded part, so the condyle, which is that rounded end piece or projection, fits into the cavity of an adjacent bone. And we have some movement here. So that's our knuckles, right? So our knuckles, we can kind of move these back and forth this way, but I can also move them this way, okay? So it's not simply a hinge, right? Because I can move them other directions as well. Okay, so joints between my metacarpals and my phalanges. So these would be the metacarpals. So this would be the bones that make up the palm of our hand. And then that's the phalanges there. And then the saddle joint, this is the joint, like I said earlier, that's between the carpals, which are my wrist bone, and the metacarpal, which is the palm part of my thumb bone, okay? And that allows this movement, and this is where we say we have an opposable thumb, okay? All right, so we're going to watch another little video here, and this video is a crash course, but we're not gonna watch the whole video. We'll start at 3:40 into the video, because that's where the joints start. There we are.
Are you sick of flipping pages to learn anatomy? Are you bored of uninspiring atlas?
I am so glad that you guys are not 5 years old. If you were all in, like, kindergarten, the only way I could teach you about your skeletal system would be to sing you that stupid song. You know, the toe bones connected. What they do is form which you can't really without talking about the other. So the structural classification of your bones is all about what kind of material binds those bones together. Like, is it a fibrous tissue or cartilage or a special fluid-filled joint cavity? But the functional classification focuses on how much that joint can move. So for example, you have joints in your body that don't move at all. These include, say, the joints between the bones that make up your cranium. These non-moving joints are called synarthroses. But you also have joints that move only slightly, like the spot where your 2 pubic bones meet to form your pelvis. That joint exists mainly to absorb shock from walking and running, but it also has proven very handy during things like childbirth. These partly moving joints are called amphiarthroses. Finally, there are the diarthroses, which are fully movable, like your classic knee and elbow joints. They're mostly found in your limbs. But if you eventually find yourself in the business of examining and treating people's joints, and there are a lot of doctors who do, then it'll be especially useful to know the structural classifications. Structurally speaking, you've got fibrous, cartilaginous, and synovial joints. Fibrous joints connect bones with dense fibrous connective tissue and are mostly immovable, like those sutures between your skull bones. As you might guess, your cartilaginous joints unite bones using cartilage and are similar to their fibrous brethren in that they don't move very much and they lack a joint cavity. But the family of joints that make all the sports and the entire art of breakdancing and yoga possible are the freely movable synovial joints. Most joints in your body fall into this category. Although they do make use of cartilage and fibrous connective tissues like ligaments, they're different in that the bones they join are separated by a fluid-filled joint cavity. The cool thing about these cavities is that they contain a bit of viscous, egg white-like synovial fluid that acts like grease on a hinge. Without that lubricant, just running down the street could cause enough friction not only to wear out your joint surfaces, but actually overheat your joints enough to essentially cook the surrounding tissue and leave your legs smoking like a desperate Looney Tunes character. These freely movable synovial joints come in 6 different configurations that together allow pretty much any movement your body can make, from a subtle head nod to a vigorous jumping jack, all of which you will find in action at your typical dance party. Seriously though, dance parties are an excellent place to study skeletal physiology. I mean, let's just take this from my perspective. I'm at my high school prom. I'm wearing a tux that is really uncomfortable and I'm feeling kind of shy standing on the edge of the crowd. Maybe I want to test the waters out a little bit with like a little hand dancing, just a hand going. Waving my hand from side to side. It's a type of gliding movement, one that occurs when one flat bone surface glides over another. All these motions use gliding or plane joints movements like the one between the distal ends of your radius and ulna and the carpal bones of your wrist. But say after a while, I feel like these gliding movements just aren't enough to fully express myself. I have to enlist the more versatile angular movements. These are the types of motion that either increase or decrease the angle between two bones across any plane in the body. Like if I bob my head or kick my leg up or raise the roof, if people still do that. If that bending motion decreases the angle of the joint and brings those bones together, like when I bend my arm together, that movement is called flexion. When I bend it back, I'm increasing that angle, and it's called extension. And if I continue that motion beyond my normal anatomical positioning, and it's somewhat dangerous, that is called hyperextension. These motions enlist the hinge joints. Similarly, my oval-shaped condylar knuckle joints allow my fingers to bend and ball up for a good fist pump. Now I'm getting super into it. I might like raise my arms up over my head. Well, the act of raising my arms away from my body is called abduction, while moving them back down toward the body is called adduction. And this here like lasso movement, that's circumduction, a combination of all 5 of those movements that allow the forearm to move in a circle while the elbow joint stays relatively stable. Which really makes you want to give credit to those cowboys. Now if you want to get really serious about that lassoing and expand it to include the entire arm, the move eventually will morph from an angular movement to a rotational one, a motion that turns the bone around its axis, in this case, the humerus. Hip and shoulder joints use a ball and socket design that allow rotational movement, but the more flexible a joint is, the more unstable and fragile it is, which is one reason why you see so many dislocated shoulders and hip replacements. And it's worth pointing out that some movements are just special and unique and weird and only occur in a few select joints, especially in your hands, feet, and jaw. For example, your ability to touch your thumb to your fingertips or give a thumbs up is thanks to opposition movement facilitated by your saddle joint, which makes your thumbs opposable. The pivot joint between your radius and ulna allow you to rotate your palm forward or anteriorly in a motion called supination, and turning it backward or posteriorly is called pronation. So that's what I like to think is the more grown-up approach to teaching you about your skeleton. It did not involve any singing, but yes, a little dancing. And it was worth it because you learned about the basic structure of your skeletal system in.
Okay, let's go back. Hopefully this shares now. There we go. Okay, so we'll just talk really briefly here about stable joints and unstable joints. So what we classify as a stable joint is there's a tight fit with the bones and the joint, so the two bones fit together quite nicely, and there's a lot of support on that joint, so a lot of muscles and ligaments that are going to hold that joint together and keep it stable. However, the more stable the joint is, there's a reduction in the flexibility or movement of the joint, okay? So if we have all this structure that's holding it nice and tight together, then the joint's not able to move as much. However, if it doesn't move as much, then it's more resistant to dislocating, where the joint, the two bones of the joint get pulled apart, okay? So your hip bone, so even though in the video we just watched, they talked about hip bones being replaced, you don't see a lot of dislocations happening in your hip bone, okay? So there is less mobility. So even though it's a ball and socket joint, there's not quite as much mobility as there is in a shoulder joint, okay? So unstable joints are joints that have a looser fit, right? So there's more movement, the bones don't fit quite so tight together, and the external support isn't so strong. So it gives a little bit more movement within that joint. Those bones can kind of move a little further apart, giving us a little bit more mobility. So we have more mobility around the joint. However, because there's more mobility, there's a bigger opportunity for dislocation to happen where those bones get separated from one another, okay? All right, so an example of that is the shoulder joint, and we often hear about people suffering from a dislocated shoulder because of there's that lack of support there holding those two bones together, okay? All right, I think this is where I stopped with my block 1 group, so this is where I'm going to stop here today. We will finish talking about joints on Monday, so there's no worksheet on joints yet because next Wednesday, sorry, there's no worksheet on joints yet. I'll get that to you next week after we're done the next PowerPoint, or finish this PowerPoint. Any questions, you guys? All right, so seeing that there are no questions, I guess we will sign it off today. So enjoy the 4 days off of school. Hopefully you have some time to not have to do schoolwork. And we will see you guys next Wednesday.